One of the most disappointing but sad things that happens to me throughout my 36 years of chiropractic practice is when a new patient would come in, they have a history of low back surgery because of a disc bulge or a disc herniation, and the sciatic symptoms that was so severe that it created pain, tingling, numbness down the leg to where it was unbearable. So they had the surgery, and some of these people actually helped. But eventually, the reason why they come into my office is because all those symptoms returned. They're a condition called failed back surgery, which accounts for 15 to 74% of all low back surgeries in the United States. In fact, in the United States, we perform 40% more surgeries than any place in the world, costing America more than $100 billion a year. Back pain is the second leading cause of disability in the United States. Now, how come there's so much failed back surgery is because you got to look at what's happening. When they cut the spine, they're cutting through the skin, the fascia, the muscles, the tendons, the ligaments, along with sometimes the bone, which means they're making permanent changes to the spine without really getting down at the correcting the cause or the structural problem in the first place. And the second most common cause of a secondary back surgery is going to be to deal with cleaning up all that scar tissue in the first place. So the goal of this video is I'm going to give you the 5 steps that I give my patients to where they can change the structure and get down at the cause to make changes so it will change their function of their spine, change the way they move, get rid of their pain, get their life back. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. Before you perform any of these recommendations, make sure you check with your healthcare provider and make sure this is correct for you. So what is it that's causing these discs to wear out? Because discs are little shock absorbers in between the vertebrae. They have a very tough capsule around it. It's 80 interconnective rings of this fibrous tissue called the annulus fibrosus. It's like a Kevlar bulletproof jacket. Then they have this jelly substance in the middle called the nucleus pulposus. And these discs are designed to last your lifetime, 80 to 120 years. And the way they get nutrients, because they have a poor direct blood supply, is through a function called imbibition. Is through motion of the vertebrae. It causes to draw in nutrients and fluids necessary for regeneration and repair of that disc, and then it pushes out the waste products. That's a natural process to keep the spine healthy. So we need motion in the spinal joints. But how the discs wear out is through traumas and repetitive structural imbalances that cause one or more of the spinal bones to become stuck or they don't move properly, and then it causes an adaptive change in the spinal curve, for example, from a normal, healthy, springy, lordotic lumbar curve to a flattened out lumbar curve. So when you have those specific bones that don't move properly, now it's not going to hydrate the disc because there's no motion of the disc. Then the disc becomes dry and brittle like beef jerky. And then from the constant pressure of the disc being pushed through the wrong direction, it's going to break down, become the disc bulge, eventually it's going to herniate, and it gives you symptoms, and that's what drove you into the surgeon in the first place to have that surgery. Because most people think that when they think about the spinal problem, they think it's a muscular problem, that they need to strengthen out the muscles, which is fine, but muscles get information from the central nervous system to either contract or relax. That's it. And when you have these segmental dysfunctions, and hypolordotic curve, it causes a slower, weaker nerve supply to the muscles, organs, and glands in the body, which is going to cause dysfunction of those muscles and imbalances. So the goal of what we're going to do is we have to return the structure, allow for better function, so you can function better and get your life back. Also, there's been studies on MRIs with asymptomatic subjects, no back pain, and they found that 37% of 20-year-olds already have significant degenerative disc disease, disc bulges, and these spinal weaknesses, but no symptoms. So we got to change the structure before you start getting those symptoms. Let's go ahead and get started. Step 1 of structural rehabilitation of your spine and disc is number 1, you have to hydrate the spine because the discs are mostly water and minerals. So you want to drink 1 ounce of water for half your body weight, and you want to supply electrolytes or minerals. So you take water and you take a pinch of Celtic sea salt, stir it up, and you drink it with your water throughout the day. This will supply the proper nutrients for your disc. So as you apply the second part here of spinal motion, A great way to get spinal motion is through performing wobbling. Wobbling is where you take a vestibular disc and you blow it up, overinflate it so the diameter is smaller, and you perform flexion exercises. So you want to do 25 flexion exercises, 25 lateral flexion, and 25 rotations. And you perform these exercises 3 times a day. Some people like to place this vestibular disc at their station on their computer, so they're wobbling or getting motion throughout the day, so they can load and unload that disc and keep it hydrated, so it keeps motion in the spine. Also provides proper spinal motion. You get segmental dysfunction in those areas. Received regular chiropractic adjustments. The chiropractic adjustments are designed specifically to provide and restore motion. Those segments don't move properly. It's there to correct the spinal subluxation or the segmental dysfunction of the joint by providing the motion back in that area. It's going to allow for a better nerve supply. The disc will hydrate. You get a stronger, faster nerve impulse to the muscles, organs, and glands in the body. So wobbling 3 times a day and regular chiropractic adjustments. Step 2 of structural rehabilitation of the spine and disc is performing daily core stabilization exercises. I find the best 4 stabilization exercises, or what I'm going to talk about, is the ones that provide the greatest amount of stability and strength with the minimal amount of risk and shearing force through those damaged discs and joints. The first one is going to be abdominal curl-ups. You want to roll up a towel, put it underneath your back, and at the level of the belly button, you want to make a fist. You want to curl up and brace as if someone's hitting you in the stomach. You want to hold that flexed position firmly for a 10 count. Then repeat 10 repetitions. Number 2 is lateral planks. You brace, you go up into a lateral plank with your elbow underneath your shoulder. Brace that for a 10 count. Perform 5 to 10 repetitions each side. This is a great exercise to prevent that lateral shearing stress. Third exercise is bird dogs. Get on all fours, extend one leg out, point the toe towards your head so you're leading with the heel. Make a fist with the other hand. Grip tight, extend out. Don't overextend. Hold that position for a 10 count. Repeat 5 to 10 repetitions each side. This is a great exercise to wake up all those subconscious muscles that'll help support that posture and the segmental stability of the joints. Fourth exercise is glute bridges. Lie on your back, lift your toes, push through the heels, contract the glutes along with the abdominal muscles braced, and extend up and hold that and repeat 10 to 20 repetitions. It's best to perform these exercises minimum 2 to 3 times a day. Third step in structural rehabilitation of the spine and disc is decompression. The best way by far, I think, is to decompress the spine is through inversion boots, because you can get upside down and perform dynamic exercises to get through range of motions, and it's much allowed to decompress the disc and open up the areas and provide motion and strengthening. However, this is definitely one that you want to check with your healthcare provider to make sure this is going to be right for you. But the easiest way to decompress is to go ahead, find a bench, a sink, a wall, a chair, and just go ahead and lean on that, lock out the elbows, take the pressure off by bending your knees. You don't need to take 100% pressure off, but as long as you're taking some off, it's going to decompress that area. It's going to provide for a negative vacuum, bring fluid into the area, and then when you stand up, it's going to push the waste products out. But it'll be a great way to get that decompression. It's very important to perform this several times throughout the day, especially before you go on to step 4 and 5. Step 4 of structural rehabilitation of the spine and disc is extension exercises. Perform a cobra. You want to do this within your available pain-free range of motion, because you want to gradually work into getting more and more extension into that spine. You go within your tolerance. You perform 20 repetitions the first day, gradually work up to over 100 repetitions a day. This is a really good exercise to heat up the spine, to start working back that lumbar lordosis, to start migration of the disc from posterior to anterior. Now, if you have shoulder problems and can't do the cobra, then you can stand up and perform extensions that way. So you stand up, you get a strap or a towel. You want to make sure that you get a good posture while you're standing there performing these back extension exercises. So you screw the feet into the ground. When you screw the feet into that ground, it's torquing all the way up. It's going to cause the glutes to automatically contract. You're going to brace abdominal muscles, thin back over that contact. And you perform 20 repetitions the first day and work your way up to 100 repetitions per day. Fifth step in the structural rehabilitation of the spine and disc is extension traction. You want to take 2 towels because you want to work on the neck curve and the low back lordotic curve. You place 1 towel, rolled up towel underneath the neck and 1 under the low back at the level of the belly button. And you lie on that with your knees bent. Start off 30 seconds to a minute and work your way up to over 20 minutes a day. 20 minutes is real important because it allows for maximal spinal molding to where it will allow for long-term correction of that spinal curve to allow for that healing of the disc, so it'll permanently migrate forward off the nerve, allow for the spinal cord and the nerves to relax, where it allows for a faster, stronger nerve supply to the muscles, organs, and glands in the body, and it allows for a more complete healing. Word of caution, things that will definitely interfere with the healing process and cause more destruction to your spinal disc is anti-inflammatories. Doesn't matter if it's over-the-counter or prescription, anti-inflammatories or muscle relaxers or steroid injections will interfere with the natural immune system's inflammatory response to heal that area, and it will cause increased destruction of spinal disc and cartilage. But definitely talk to your allopathic medical doctor and discuss these concerns, but it will definitely interfere with the process, so it's totally up to you whether you're going to use these modalities or not. The best way to use ice is to place that bag of ice on you right before you work out, or you can do it, place it on and go for a 10-minute walk before you really get into other types of exercises. Then that at least allows for you a little bit of pain relief and allows you to get into your exercises a little easier. Now, once you see improvement and you see that things are coming along, you're getting stronger, and you want a great daily exercise program for the spine and spinal conditioning, check out this video right here. And if you're new to my channel, if you want more spinal-based home exercise programs, go ahead and subscribe. Keep spreading the word. Really appreciate serving you. We'll look forward to seeing you on our next video.